and welcome to Supporting Healthy and Sustainable Human-Animal Bonds, examining pet guardians' access to veterinary medical and behavioral services during COVID-19. Dr. Auri Wu from the School of Social Work at Dalhousie University and myself, Amy Morris from the Vancouver Humane Society, partnered together to create a research study called Compounding Crisis in Veterinary Services, Lesson Learned from Low-Income Pet Guardians' Experiences at Private Clinics and Hospitals during COVID-19. I'll be sharing that with you today. We suspected that COVID-19 had a big impact on low-income pet guardians, recognizing that low-income status, combined with the COVID-19 pandemic and people who have pets for emotional support, who may be in need of urgent veterinary assistance, which was limited during the beginning of COVID-19 pandemic, could create a recipe for disaster. For example, one participant was quoted as saying, "The problem I found was not being able to go in with him because he wasn't used to vets, so it was scary for him. That was a horrible night. Honestly, that was really, really tough." We designed the research to reflect the experiences of people who were in need and low income, so we decided to use in-depth, semi-structured interviews with people who specifically identified having challenges related to COVID-19 and asked them about the resources and support they received to address these challenges. All of the participants were companion animal guardians who accessed financial assistance for veterinary care from the Vancouver Humane Society in Vancouver, Canada. There were 12 participants total. All of these participants were screened as low income using a guide from Canada's Statistics Department. All participants identified as experiencing limited or no work during the pandemic. There were a number of findings and themes that came out of these interviews. The first was about that participants had experienced a lack of empathy from veterinary workers and found it hard to make decisions of where to go based only on necessity and affordability. They stated that it seemed like that the vets just wanted the money or that there's inconsistency in their pricing and care. They even said that they felt that they were trying to be charged for things unnecessarily and described having gone to a veterinarian where they obviously do not really like animals. Participants also described limited access to financial supports at the time that payments were required. For example, one participant had concerns over the veterinarian keeping an animal in a state of suffering just due to the cost. They suggested the veterinary clinic should be more forgiving and asking for an $800 deposit. Most people, especially with COVID, don't have that kind of money. It would be helpful to work out a payment plan, or if somebody's helping to fund it, maybe they can wait until the next day or a couple of days just to be more helpful that way. It's more for the animal that they shouldn't be gatekeeping that care to keep them from being in distress. Another finding was that there was emotional stress that came from not having finances available. Some participants shared the different stressors they experienced, such as one where they had to do a urine test and it ended up being $450 they didn't have. Another participant outlined that the feeling everything's fine and all of a sudden, bam, right? You just never know. Something's going on with their pet out of the blue and they're not expecting it and feeling that everyone is struggling really hard right now during the pandemic. Participants also experienced acute stress emotionally from seeing their pet suffer and not having the funding available right away to do anything about it. One participant stated, "I'd rather go hungry than be able to have my cat die." And another stated, "People live under constant stress because of bills and then having a sick animal. You never want to be in a situation that you have to question your animal's health or life over being able to afford a roof over your head." A final barrier that participants faced was related specifically to COVID-19 emotional stress. One participant stated that not being allowed inside the vet is very heartbreaking, not to be there with them, not knowing what's going on or being able to hang out with them. Another participant said that they didn't have a cell phone. So with the procedures, they had to go to the vet, drop their pet off, and then the vet would expect to call you on your phone while they're doing the exam. So these kinds of situations led to stress on top of the pre-existing stress that these low-income guardians already faced. There were some findings related as well to resilience, and we found that low-income pet guardians are extremely resilient. They have a strong human-animal bond, with guardians saying things like, "I love my cats with all my heart and soul," and "I've never had a connection to an animal like this," and "She brings us so much joy." Low-income guardians also look for assistance from their family, friends, and community, and that support is really meaningful for them. Even if it's not financial, it provides significant benefits. For example, one participant said, "I asked if a good friend of mine would help us take us to the vet and let me use his cell phone. He let me put coins in the meter, but he wouldn't take any money." That was amazing for him to do because these vet visits were like 45 minutes on the phone, right? You can't really go anywhere for coffee or do anything. Another participant shared that there was quite a few independent women where it was their passion to help others. They couldn't actually do anything other than offer emotionally support, but this community help was really great for the participant. They gave a list of possible contacts and provided a network, and that became something that helped the participant quite a bit. The final finding around resilience is really about the individual resourcefulness of low-income pet guardians. Participants demonstrated that they were resourceful to try to find what they needed to help out their pets. What can we learn from the perspectives of low-income pet guardians, and what are the one welfare actions that we can take? Participants who were interviewed shared about what they thought could be improved to make their own experiences better, and I'll highlight that for you now. The first really falls under trauma-informed service delivery. Participants, as well as other existing research out there, has suggested that low-income clients, like all clients, want to access services that are non-judgmental, empathetic, collaborative, based on collective decision-making and trust. They want their animal services to be culturally competent, respectful, and understanding. We know that the outcome of this approach leads to better understanding for the client, and that means better care for their pet patient. It would also provide an opportunity for clients to feel like they had the capacity to give more kindness to the people providing services, and that leads to better mental health for veterinary and animal service workers. All of this means there's a higher likelihood that a client would go to a veterinary clinic or hospital or access animal services earlier in the future, decreasing the likelihood of more severe animal suffering and well-being for everyone involved. Another finding was really about decreasing barriers to accessing care for low-income pet guardians. Animal service agencies can reduce the limitations on veterinary assistance programming to make them more accessible. They can provide assistance with a variety of pet services, not just veterinary care. They can also provide funding for both preventative and emergency assistance. Finally, they can increase the advertising of programs so private veterinary clinics and hospitals are more aware of them. Likewise, in order to decrease barriers to access care for veterinary services, private clinics and hospitals can offer some things that would really decrease barriers to access care. These include lower costs for low-income pet guardians, offering the opportunity to pay off services over time, considering more standardized prices within a region to make it easier to know where to go, and actively learning about available veterinary assistance programs from animal service agencies so that they can assist clients when they share the intimate reality that they're experiencing a period of low income. The outcome of implementing all of these trauma-informed service delivery recommendations and decreasing barriers to accessing care is that there's more recognition of the impact that One Welfare has and the cycle of well-being for all involved. This benefits everyone, and they all experience a better outcome. Thank you so much for your time today. Please feel free to contact us at any time.